Hi, I'm Dr. Adam Scheiner. In this video, I'm going to be demonstrating how to use hyaluronidase to dissolve hyaluronic acid that's causing irregular skin contours and a tyndall effect in the lower eyelids. Here you can see the irregularly placed hyaluronic acids put into the lower eyelid region. This filler was actually put in place about 4 years ago. Today we're going to use Vitrase to dissolve some hyaluronic acid from the lower lid region that was placed approximately 4 years ago in our current patient. And this is the Vitrase, comes in 200 units and 1.2 cc's of fluid, and we're going to inject 1.2 cc's in each side of the lower lid. Patient, and she had fillers put of hyaluronic acid put in the lower lid area. And so where we think the filler lies is right here and right here. I think what they were trying to do is she had some fullness up in this region, and they're trying to camouflage that, but as I often see, this isn't usually the best product, or even this idea of filling the lower lids is not a great idea to do for people who have actual bags. Surgery is really the better thing for them. But what we're going to see here today is we're going to put the hyaluronidase into this area here, and we'll put it under compression, and then we'll get to see what it looks like afterwards. Okay, so what we're going to do now is we have the hyaluronidase in this cc. We have about 1.2 cc's here, and what we're going to do is we're going to layer it right in this region. This is where we think that this Juvederm or Restylane, where the hyaluronic acid was placed all those years before. So what we're going to do is we have a little alcohol swab here. We're going to clean off the area first that we're going to work on. Sorry, take off all your makeup.
I know, right?
And this is the area where we see it right here. Even with the light above, you can see that ridge, and that's where I think we're going to see that improve. I can almost see a little bit of the blue cast underneath the skin there. Okay, so we have our 4x4 here, and I'm going to prime our needle. Okay. Okay, just take a deep breath in for me, and then let it out. So almost the way sometimes you'll put in a filler, I'm doing sort of a little bit of a fan pattern here, and a little bit deep. And then one more here for the more medial part. Almost done here. Okay. Next, what we're going to do is to put the eye pads on the areas where we injected the hyaluronidase, where the hyaluronic acid was. We're putting this under pressure, so I fold one eye pad first, and then I put a second eye pad on top of it. We then use tape, and we will be securing these two eye pads, EYEPADS, with tape from the center of the forehead to the cheek region. I usually pick up the cheek a little bit to create a little more pressure there. And here we are putting on both laterally and medially. I then will usually do one more right down the center to put under just greater tension. We're trying to push the hyaluronidase into the tissue with the application of these eye pads. We've injected the first side, and that is now under occlusion. We're now about to inject the second side, and likewise put it under occlusion. And what the occlusion does with the eye pads actually drives the hyaluronidase into the tissue where the hyaluronic acid is in an effort to dissolve that hyaluronic acid. Okay, so what we were just noticing here is we think we have a little bit of the tyndall effect of a blueness cast underneath the skin. So we're going to inject here all the way up into the tear trial, and that's probably what they were trying to do back then, was to help camouflage the fullness. Unfortunately, in people who have real fullness in their lower lids, it usually doesn't work that well. Okay. Okay, wait with me here. And so we're doing this little fan pattern. And then we go a little bit up near medial. Sorry, honey. And the last part right here. Okay. So we're down there. I'm going to take two eye pads. You're doing great. And we're going to fold it over So it's starting to pressure on this region, and then we're going to put a second one on top of it. And here's our first bit of tape. Usually start up in the forehead, and I pick up. Nope. One more time here. We start up in the forehead, and then put the second part on the cheek region here. And the last one, I create a little more pressure on this last one here. I'm going to drive that into the tissue. And very good. So we're going to let this sit for about 20 minutes, and then we'll take it off and we'll get to see the reveal. Thank you. Okay, so now it's been 20 minutes, and we're actually going to take off the bandages, and we'll see if there's been dissolution of the hyaluronic acid in the areas that we were trying to treat. I apologize, this can pull just a bit. So I knew this was the second side we did, so the way the tape lies. Sorry. And it looks amazing.
Wow.
Open your eyes for a second. That looks amazing. Fantastic. Okay. And then we'll do the same on this side. Sorry for the pulling. Sorry. It's dissolved. That, yeah, it's all dissolved. Let's sit Jeff here. It was right there, remember? Mm-hmm. So these are the fat. Now these are the fat pads.
Now it's
but
showing, yeah.
But what was here was filler is now all dissolved and even improved right there in the tear trough. So now we're gonna be able to tighten all this tomorrow with my procedure for the laser. Thank you. So you can see the difference there now?
Yeah.
And so this is the way that we can dissolve hyaluronic acids. This happens to be in the lower lid area, but that same technique can be used for any place you use hyaluronic acids. A lot of times we'll use it for obstructions, vessels. So if you have it in the nasolabial fold, you can put the same amount in, you put it under pressure with tape. I find it drives it into the tissue a little bit better. And thank you very much for watching. Once again, this was the appearance of the patient with the fillers in the lower eyelid region before dissolving them. This is the patient one day after dissolving the filler with the hyaluronidase. This is a preoperative photo where she was going to have lower eyelid fat manipulation and tightening of the skin with laser skin resurfacing. This is another example of irregularly placed hyaluronic acids in the lower eyelids. Thankfully, the fillers put in the lower eyelids here were hyaluronic acids, and I was able to dissolve them with hyaluronidase. This patient had fillers put in her tear trough years before and was really disturbed by the blue cast that was shown through the skin, otherwise known as the Tyndall effect, and she responded beautifully to hyaluronidase treatment of these tear trough fillers.